Hey guys, Jill here from Ask a Vet Tech. Today we're going to talk about pancreatitis. The pancreas is a vital organ on the right side of the abdomen, and it produces an enzyme called trypsin to assist in food digestion and hormones such as insulin to regulate the blood sugar and the metabolism. When your pet eats high-fat foods, there's a release of a large amount of this hormone, causing all kinds of havoc to happen inside of your pet's body. Why is any of that important to your dog? Well, it isn't to them, but it should be on your radar because what they eat definitely affects them. In most cases, the cause of pancreatitis is unknown in nature, and they call that idiopathic, until the owner of the dog tells us what could have possibly been fed or eaten, or if they've gotten into the trash and had a buffet of many things that don't belong in their little belly. There are two types of pancreatitis that dogs and cats can get. The first one is chronic, or it has been going on for a long time, and it's kind of building over time. It comes and goes. The second is acute, meaning it came on all of a sudden and your pet is extremely ill. Cats only have one pancreatic duct, which joins the common bile duct before emptying into the duodenum, which is why it is common for cats to get chronic pancreatitis, due to their diets being higher in fats. Another factor for them to get sick is not having proper vaccines to protect them against feline calicivirus, feline herpes virus, feline coronavirus, and trying to fight off Toxoplasma gondii, which is a parasite, can be another reason why they have chronic pancreatitis. Most commonly, dogs get acute pancreatitis and cats get chronic pancreatitis, but not always, because every pet is unique and comes with their own issues. There is no breed of dog or cat, gender, or age that this condition shows up in commonly. Risk factors for developing acute pancreatitis include dietary indiscretion or eating something they normally do not get that is really high in fat, blunt force trauma such as being hit by a car or falling down a flight of stairs, something traumatic, or the use of pancreatoxic drugs. Clinical signs and symptoms in dogs are diarrhea, fever, bloat in the belly area, abdominal pain, vomiting, and they sometimes position themselves in a hunched over position or a praying pose like this. And sometimes, if the attack is really severe, they'll be laying out and not willing to move at all in pain. For cat symptoms, it's anorexia or refusal to eat, being lethargic, weight loss, vomiting, or hypothermia. How is it diagnosed, you ask? Well, a good history of what the pet has been up to or has been fed, or if it's had an injury, is the best way for the vet to understand their lifestyle. Being really upfront with your vet at this point is extremely important. Tell them what treats you feed, what dog food they eat, and other human food that they regularly get. If it's a holiday or special occasion, what they got into, and XYZ. Secondly, a blood test that can check the patient's pancreatic enzyme levels in the blood, and some diagnostic imaging such as an ultrasound should be done. If the vet is unsure, going a little bit further, they could need to do a pancreatic biopsy, which is like a surgical procedure to remove a small portion of the pancreas to send it into a laboratory for testing. I personally have never seen this procedure done because normally we want to get treatment started right away, and doing the surgery and waiting for results is wasting precious time, causing more discomfort for an already uncomfortable pet. Unfortunately, some dogs with pancreatitis, especially chronic pancreatitis, will escape detection in many of these tests. Consequently, the diagnosis of pancreatitis is based solely on clinical signs and medical history. Before we hop into the treatment process, if you wouldn't mind hitting that like button and subscribing to my channel so you don't miss a thing, that would be awesome of you. What is the treatment for pancreatitis? Most commonly, a dog or cat is admitted into the hospital and administered IV fluids as soon as possible. Through the IV, we give the patient pain control medication, anti-nausea medication, and antibiotics to prevent a secondary sepsis from forming from the tissue that is dying in the pancreas. Depending on the patient's needs, we can feed the patient through a tube that goes through their nose called a feeding tube. Most pets won't eat at this time. That is why a feeding tube may be used. Water is often available in small quantities to help further prevent vomiting of the patient. We're there to get them to stop vomiting, not to give them a bunch of water to drink to vomit again. They're getting fluids to stay hydrated through an IV, so drinking a lot of water is not necessary. Patients with chronic pancreatitis commonly have a history of recurrent, intermittent, milder episodes of clinical symptoms, making it a really difficult diagnosis, just going on the clinical signs alone. Further testing should be done if it is suspected. Chronic pancreatitis can lead to other issues for your pet, such as exocrine pancreatic insufficiency or even diabetes mellitus. Both of these conditions must be under the care of a doctor to make sure that your pet is getting the treatment that they need to be comfortable. The prognosis depends on the severity of the disease and the response to the initial treatment. Dogs that present with shock or depression have a very guarded or grim prognosis, unfortunately. Most mild forms of pancreatitis have a good prognosis with aggressive treatment. Dogs not treated may progress into a hemorrhagic form and suffer severe consequences, such as multi-organ failure or sudden death. Let's get into what pets should not have to avoid this terrible, expensive disease. Making sure that their food is not super high in fat is where we should start. Giving your dog a food that is of balanced nutrition is best. Feeding a lot of canned food is not great for your pet, even if it's the only food that they eat. The biggest concern in canned food is gravy. That is a big contributor to pancreatic issues in small dogs mostly, because they seem to be the ones that get a lot of dental issues. And they're commonly fed only wet dog food. So that being said, feeding your dog a big plate of mashed potatoes and gravy for a holiday meal is a bad idea too. Gravy is very high in fat, and being that it is made from fat drippings of a ham or turkey, why wouldn't it be made of fat? Next on my do not feed list is pork in any way, shape, or form. Ham, bacon, sausage, lunch meats, bacon grease, poured over food. Please avoid that. It is super high in fat. Processed meats and cheese can be really high in fat too, such as hot dogs, sausages, bratwursts, and can-packed meats, Spam or Vienna sausages. Treats that are high in fat, which many of them are, and that is why your pets love them dearly. Limiting them or offering them some lower fat treats is much better for their long-term health. Moving on, cooked meat bones with fat on them. This can cause more than one risk. Cooked bones will splinter when they're chewed on, and that can cause cuts in the mouth and, if swallowed, major intestinal issues. The fat seems like a great treat. It might just cause you and your pet serious issues. Please do not give them beef bones, ham bones, chicken bones, or turkey legs. Other items that seem so small that they couldn't cause harm would be butter, onions, turkey skin, milk, or cream. Moving onward down our list in dessert form, candy, cookies, pies, raw rising bread dough, and anything with xylitol in it. Last but not least, do not give your dog table scraps after your big holiday meals. This is a recipe for disaster. Instead, give them just a small bowl of mashed potatoes with no butter, gravy, or grease, or just some low-fat dog bones. I know this is not what every pet owner wants to do. I mean, before I knew better, I used to give my dogs all kinds of things. But when you know better, we can do better. I'll link below some of my favorite dog bones that are low fat. And here's a video link that can help you in an emergency situation to know what to do for your pet. I'll leave a link right here. Go check it out. Please let me know if you have any questions or pet issues that you'd like me to educate you on. I appreciate each and every one of you for watching. I'm here for you. You're here for your pet. Have a great day.